Joining me now from London is Matt McKee, a Professor of European Public Health at London School of Hygiene and Tropical Medicine. Professor, thank you so much for your time. I would say for many of us, we're still recovering from the trauma of experiencing COVID. The World Health Organization has been very careful in making the distinction between Hantavirus and COVID, but should we still be worried?
This is a serious disease for anyone who gets it. It has a fatality rate of about 1 in 3. So therefore, it's really important that we do everything possible to stop the outbreak from spreading any further. Now, it is a virus that does not spread at anything like the rate that COVID does, but it does spread from person to person. I think we have a very unusual set of circumstances here. We had bird watchers who were going into a very high risk place, to a landfill site where there were lots of birds, but also obviously lots of droppings from rodents. And they then got onto a boat, which we know is what we call an institutional amplifier. It's a perfect place for spreading it. However, it then went into a very remote part of the world, the South Atlantic. So it has been possible to trace the relatively small number of people that were in contact with those initial cases. It's really important that they're traced, that they're quarantined, and that we stop the outbreak from spreading any further.
I just want to ask you, given what you've just said, what prevents Hantavirus, therefore, from becoming a COVID-scale pandemic?
It's nothing like as infectious. What we do know, which is actually relatively little, is largely from a couple of studies in Argentina. One very well-conducted research study in 2018, which looked at the spread of hantavirus in 3 people who went to a wedding and they then to a party, and then they spread it around the community that was with them. So we know a lot about the level of exposure. COVID spread very rapidly, and this doesn't spread anything like as fast, but it still is something that we do need to be careful with. I think it's going to be much easier to control it. The difficulty is that the incubation period is much longer, so people will have to isolate for 6 to 8 weeks. That will be a challenge.
Now, we have here in France a patient who's in a critical condition in hospital. Of course, as you and I know, there's no vaccine in existence. So will conventional treatment be enough to ensure her full recovery?
We do know that there is a high death rate with this condition, and the protocol in Chile, where of course they have a lot of exposure, is that anyone who has the virus is taken to a very high level hospital with the facilities, particularly to take over the functioning of the heart and lungs, because people can deteriorate quite quickly. But once somebody is in a well-fit, well-equipped hospital with the appropriate level of staffing, then their outlook should be good, but there still is a risk.
Now, given, as you mentioned there, the incredibly long incubation period, I think of around 6 weeks or so, does self-isolation work for contact cases? And I also want to ask, it seems there are some differences in the way in which various countries are keeping an eye on managing this virus, and how much of that will pose a problem.
Well, I think that there are differences, particularly with the United States. Of course, the public health system in the United States has had a very traumatic time over the last few months. So I think there are challenges there. We looked at this in some detail during the COVID pandemic, and you really do need to give people a lot of support if they are isolating. You need to make sure that they have, obviously, food and drink and the necessities of daily life. You need to make sure that you have psychological support for them. And we talked about the need for patient-centered isolation. You can't just lock people away. And these people will be frightened. They are very vulnerable. So I think there is a need for support. We need to look at income replacement, for example. We need to look at all the things that you need to do just to keep living in this modern world. So I think the authorities do need to be very much on top of this.
In the meantime, from a scientific perspective, could a mutated hantavirus realistically evolve into an increased airborne human-to-human transmission? Or are there major biological barriers as such?
Well, one of the things we know about the evolution of viruses that you can never really predict. In fact, there are some characteristics of this virus that do suggest that it might do. The thing that at the minute is that it has evolved to fit with the rodents in which each variant inhabits. So it's become very highly specialized to voles and different types of mice in different parts of the world. But of course, when it does spread to another species, then you do get a different environment, which will encourage any mutations there to thrive if they can. So there is always a risk with this. One of the things we've been very fortunate with is that the distribution has been really quite localized with each variant associated with its particular rodent host.
And of course, there is no vaccine. I imagine now that the pressure is on within the pharmaceutical industry to perhaps start working quickly to come up with a vaccine for this virus.
The difficulty with that is that the market for the vaccine will be relatively small. Now, of course, we are now in a much better position than we were 5 or 10 years ago with the mRNA technology that was used for the development of some of the COVID vaccines. So in the same way that you can develop individualized vaccines for many cancers now, then I think we will be able to produce relatively small batches. So technically it will be easier, but the difficulty will be the market for that. The other thing about hantavirus is, of course, like, unfortunately, we still have so many neglected tropical diseases, and they're neglected because the people who suffer for them don't have the purchasing power. And so that will be a challenge, tragically. It's very unfortunate. So the question will be whether somebody thinks that the market is big enough to produce this, but that's where governments and the international community need to come in and look at the economics of that.
Professor McKee, thank you so much. That's Professor McKee, Professor of European Public Health at the London School of Hygiene and Tropical Medicine.